The stages of arthrosis are displayed according to the radiograph. The first stage is a slight thinning or a normal layer of cartilage tissue, accompanied by such symptoms as periodic pain in a particular joint, increased muscle tone surrounding the joint. The second stage is a pronounced violation of the joint surface, narrowing of the joint gap. At this stage, there will already be pronounced pain and possible stiffness of the joints in the morning. It is often accompanied by a change in the patient's static posture depending on which joint is affected. The third stage, the cartilaginous surface of the joint is almost destroyed. Osteophytes in the joint cavity, bone growths, will also be noted on the picture. This stage is accompanied by severe pain, a pronounced decrease in mobility in the joints, significant atrophy of the muscles surrounding the joint. Arthrosis as a pathology has a polyetiological nature, that is, it can be caused by a number of factors. This is overweight and a sedentary lifestyle. Hypodynamia leads to a decrease in the synovial fluid of the joint. This is the fluid that nourishes the joint. Leads to weakness of the muscles surrounding the joint and acting as a frame, to weight gain, which as a burden puts additional pressure on your joints. Also, with a hypodynamic lifestyle, a person loses dexterity and coordination, which, for example, leads to injuries at home and at work. The second reason can be an unbalanced diet and insufficient water in the diet. In addition, there are more specific reasons: endocrine disorders, liver pathologies, genetic defects of collagen, bad habits, injuries. X-ray and MRI are the main diagnostic methods for arthrosis. X-ray is a faster and more affordable method. It diagnoses changes in the hip and knee joints quite accurately. MRI, in turn, is a more accurate and cost-effective method that requires certain doctor skills and conditions, for example, the absence of post-operative metal structures, and the absence of such diagnoses as epilepsy, claustrophobia, etc. As for treatment, everything will depend on many factors. The age and weight of the patient and the stage of the disease are decisive. The patient's age tells us about the resource of the body. And if the third degree of arthrosis was diagnosed in a young athlete, there are good chances to significantly improve his quality of life with conservative methods. But if this is a more mature patient, then prosthetics will be a priority. In many cases, the first and second degree of arthrosis is treated conservatively, with the exception of complex diagnoses. Also, accompanying chronic diseases are taken into account in the choice of treatment: diabetes, hypertension and others. Physiotherapy methods and pharmacological methods are distinguished among conservative treatment methods. Pharmacological means include non-steroidal anti-inflammatory drugs, hormonal anti-inflammatory drugs, and muscle relaxants, drugs that reduce muscle tone through the central nervous system, thereby improving their function. Physiotherapy methods include electrotherapy, electrophoresis with medicinal preparations and others. Ultrasound therapy or phenophoresis, which also stimulates metabolic processes in muscles and tendons, delivers medications to tissues. Methods of motor rehabilitation can be distinguished separately. Classically, the muscular system is restored in 4 stages. First stage of static movements, movement in one position. The second stage is the stage of partial muscle contractions. The third stage, the stage of dynamic movements, full bending of the injured limb. The fourth stage, plyometrics, jumping, complex coordination movements. For many patients, it is difficult to understand the fact that movement best treats the musculoskeletal system. Also, kinesiotherapy requires consistency and a certain period of time. To prevent arthrosis, you need to maintain a sufficient movement regime, water electrolyte balance, drink a sufficient amount of water, and maintain a normalized body mass index, that is, maintain a healthy weight for your height. And remember, the best treatment is prevention. Stay healthy.